Hi, I'm Henderson County Sheriff Lowell Griffin. I'm here once again today with Henderson County Health Director Steve Smith and Henderson County Emergency Management Coordinator Jimmy Brissie. We want to bring a short message to you and hopefully ease your mind about some of the events as we're still in the middle of this COVID-19 event. First of all, I want to tell you that the Henderson County Sheriff's Office is not focusing our policing efforts on the criminal enforcement of the new social distancing standards. I believe the people of Henderson County have taken this issue seriously. I think from what I've seen, the folks are practicing the standards that have been advised and are doing a really good job. I'm continually asked whether Henderson County or North Carolina is going to impose some sort of stay-at-home order or curfew. I can't tell you yes or no on this, but what I can tell you is I think with what's going on in Henderson County right now, you're not really going to see any difference in the day-to-day activities. We've had a majority of the businesses that are non-essential that have closed. Once again, like I said, people are actually using common sense, washing their hands, practicing the required distancing to prevent the spread of this virus, and we really appreciate that. And the attitude of the people alone is really superior to any policing efforts that we could put into this. The stores are doing a tremendous job. I realize it's inconvenient, but they are closing, they are sanitizing, and they are trying to restock. At this moment, there are no pending orders, or let me back up. I anticipate no pending orders to shut down roadways or to lock down the county. So I want to take that panic away from the people. This kind of leads to another issue, and it leads to an issue with our local grocers. I've spoken and visited with several grocery store managers and several stores throughout Henderson County. And what I will tell you is they are still seeing an uptick, a huge uptick in the demand for products inside. Understand this, the supply chains have not changed. There is still a strong supply coming into these grocery stores. What has changed has been the demand. It's like the panic that initially set in with people believing the rumors that the roads were going to be shut down and they were going to be isolated in their homes has continued, and it just snowballs. It leads to more panic. Even in areas states like California, New York, the state of Washington, and others that have imposed shelter in place or stay at home laws. The grocery stores, the drug stores, the essential businesses still haven't shut down. They are still operating as normal. And as a matter of fact, there's nothing normal. These folks are really working super hard to bring you the service that they do and provide the goods that they do. So let's just calm down with that a little bit. But know that the Henderson County Sheriff's Office, along with all of our partners in emergency services in Henderson County, are still devoted to providing the best service possible to you. So please stand by as I turn this over to Health Director Steve Smith.
Hello everyone, my name is Steve Smith with Henderson County Public Health. Thanks for a few minutes of your time today to provide some recent information about coronavirus and our response efforts here in Henderson County. I realize that everyone has been receiving a lot of information about coronavirus. You've seen stuff in the media, in other places, and today my good news is that I am boiling all of that down for you to 3 essential points. So these are the things that we will continue to say are absolutely the most important things to do to help minimize the spread of disease. 1, We want you to stay home and to continue to practice social distancing. This is absolutely necessary to reduce the transmission of coronavirus, which, as you know, is a very contagious disease. I have seen great examples of people doing that, and we need that to continue throughout the coming weeks. There is some great social media connections for that movement. One of those is #StayHome. So I would invite you to participate with some of those social media streams to get more information about how to protect yourself. One of the things I would say is that this does not extend to your activities in terms of how you need to go about essential daily living practices like going to work or going to the grocery store, but use some of the same precautions that you would use with social distancing when you're doing those activities. 2, we want you to continue to get information from reliable information sources. Those premier types of sites are the CDC, the North Carolina Department of Health and Human Services, Henderson County Public Health, or your healthcare provider. These are really the best guidance documents that are out there in terms of how to reliably protect yourself. We just don't want you to use other sites that might be out there on social media that aren't based on science or accurate data. 3, we do not want you to go out and to seek coronavirus testing for yourself or family members if you are only having mild symptoms. We really just want you to stay home if that's occurring. I recently saw a physician describe this in a very practical way, that if you had mild symptoms 6 months ago that are consistent with something that you are experiencing now, if you didn't go to the doctor then, don't go to the doctor now. Just coming out for the testing itself could create exposure risks for you or your family, and we need to minimize that. We also need to prioritize limited laboratory testing for coronavirus to the most high-risk populations. Those include people in hospitals, people in long-term care facilities, and the healthcare staff that take care of those folks. If we all follow these 3 steps and do our part to responsibly support that, this is the best way forward to reduce the transmission of disease and protect the entire community. I am asking for your help with these measures. I want to tell everyone that I have been duly impressed with the efforts and sacrifices to date. We are a strong community. I see everyone helping each other, and I just want to continue to assure you that we will get through this together. Thank you. I'm going to turn it over now to Mr. Brissie with Henderson County Emergency Services.
Good afternoon. I'm Jimmy Brissie with Henderson County Emergency Management. I appreciate the opportunity to spend a few moments with you sharing what's been happening in our community. Appreciate the Sheriff and Mr. Smith for their time as well. Over the past 2 months, our public health professionals and healthcare workers have been discussing and preparing for the impacts of COVID-19 in our community. And today I want to share what you can do to help us. You have heard our health director speak of 3 community priorities: stay home, stay updated, and stay isolated. In the coming days, there will be ways that you will be able to help your friends and neighbors. You will start seeing requests for donations of critical medical equipment and supplies for our healthcare providers and community organizations. We're in the process of establishing a central receiving site for residents and businesses to donate supplies to ensure they get to the facilities who have critical needs. You will also notice our local hospitals are doing the same thing. You will hear of needs of volunteers who provide essential services such as meal packaging, delivering meals, or gathering supplies. Many of our community service organizations we're blessed to have in Henderson County rely on retired volunteers who have limited availability now. The United Way of Henderson County has established a way to connect our community with agencies needing assistance through their website. Just search for Volunteer Hendo to get directed to their portal to sign up when you're available. Each of these organizations in our community are finding a way to deliver their critical services while maintaining the recommended social distancing. We're thankful for them for their commitment to serving their population. If you are in need of services, you can reach out to the United Way's 211 helpline to get connected with one of our community partners. Just dial 211 from your phone. I would encourage each of you to find time to stay connected during these coming days. Call and check on your friends, families, and neighbors. During these challenging times, having a lifeline of a friendly voice to talk to or a smile on FaceTime could be just what someone needs to get through difficult days. Don't underestimate the value of those connections. In closing, I would say that we're in a battle with an enemy that we cannot see, touch, or feel. Our community is best to have thousands of dedicated doctors, nurses, healthcare workers, paramedics, EMTs, law enforcement officers, and public health workers, but we need your help. You're our first line of defense against this enemy, and we need you to hold the line. Remember, stay home, stay updated, and stay isolated. Thank you for your time.